Chapter 35. Sexuality. Sexuality is part of a person's personality and is important for overall health. Even though discussion of sexual topics has increased over the years, many adults lack knowledge regarding sexuality. Although patients may be hesitant to bring up their concerns, they often share their feelings when the nurse addresses sexuality in a relaxed, matter-of-fact manner. To feel comfortable addressing sexuality, nurses need therapeutic communication skills and to be knowledgeable about sexual functioning, issues, and assessment. Religious teachings, cultural influences on gender roles, beliefs about sexual orientation, and social and environmental climates influence the value systems for both patients and care providers. Sexuality has many definitions. Expression of an individual's sexuality is influenced by interaction among biological, sociological, psychological, spiritual, economic, political, religious, and cultural factors. Sexuality differs from sexual health. According to World Health Organization, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. A sound scientific knowledge base regarding sexuality provides you with the necessary information to help your patients achieve sexual health. A basic understanding of sexual development, sexual orientation, contraception, abortion, and sexually transmitted infections is necessary. The first 3 years of life are crucial in the development of gender identity. The child identifies with a parent of the same sex, and develops a complementary relationship with the parent of the opposite sex. School-age children generally have questions regarding the physical and emotional aspects of sex. They need accurate information from home and school about changes in their bodies and emotions during this period and what to expect as they move into puberty. Emotional changes during puberty and adolescence are as dramatic as the physical ones. Adolescence is often time when individuals explore their primary sexual orientation. Adolescents may identify with a sexual minority group such as lesbian, gay, bisexual, or transgender, or LGBT. Although young adults have matured physically, they continue to explore and mature emotionally in relationships. Intimacy and sexuality are issues for all young adults whether they are in a sexual relationship, choose to abstain from sex, remain single by choice, are homosexual, or are widowed. Changes in physical appearance in middle adulthood sometimes lead to concerns about sexual attractiveness. Decreasing levels of estrogen in perimenopausal women lead to diminished vaginal lubrication and decreased vaginal elasticity. Both of these changes often lead to dyspareunia, or the occurrence of pain during intercourse. Later in the adult years, some individuals have to adjust to the social and emotional changes associated with children moving away from home, which may result in renewed intimacy. Studies show a positive correlation between sexual activity and physical health in older adults. Research indicates that many older adults are more sexually active than previously thought and engage in high-risk sexual encounters, resulting in a steady increase of human immunodeficiency virus and sexually transmitted infection rates over the past 12 years. Factors that determine sexual activity in older adults include present health status, medications, past and present life satisfaction, and the status of marital or intimate relationships. Both genders experience a reduced availability of sex hormones. Sexual orientation describes the predominant pattern of a person's sexual attraction over time. Many stereotypical myths remain about people who are LGBT. Non-judgmental nurses who have a solid knowledge base help to discourage these myths and provide nursing care that includes attention to the person's sexual orientation. Please review Box 35(1). Focus on older adults. Sexuality in older adults. As a supplement to this PowerPoint. Case study. Nikki is a nursing student who volunteers at a free health clinic in a medium-sized college town. Nikki enjoys volunteering at the clinic because the nurses allow her to provide health care education to the young women who frequent the clinic. Much of Nikki's teaching involves education about sexually transmitted infections and reliable birth control methods. Can you think of some challenges that Nikki may be facing as she provides care to this group of patients? Numerous contraception devices are available to sexually active couples. Unplanned pregnancies occur if contraceptives are not used or are not used properly. Methods that are effective for contraception do not always reduce the risk of sexually transmitted infections. Although abstinence from sexual intercourse is 100% effective, it is often difficult for both men and women to use this method consistently. Any act of unprotected intercourse potentially results in pregnancy and exposure to sexually transmitted infections. Barrier methods include over-the-counter spermicidal products and condoms. Spermicidal products, such as creams, jellies, foams, sponge, are put into the vagina before intercourse to create a spermicidal barrier between the uterus and ejaculated sperm. A latex condom is a thin rubber sheath that fits over the penis to prevent entrance of sperm into the vagina. A diaphragm is a barrier method that must be used with the spermicide with each sexual encounter. Vaginal spermicides and condoms are most effective when instructions are followed carefully. Their combined use is more effective in preventing pregnancy than is the use of either one alone. Non-prescription methods of contraception based on physiological changes of the menstrual cycle include rhythm, basal body temperature, cervical mucus, and fertility awareness methods. Couples who use these methods need to understand the reproductive cycle of the woman's body, and the subtle signs and signals that her body gives during the cycle. To prevent pregnancy, couples abstain from sexual intercourse during designated fertile periods. Hormonal contraception is available in several forms: oral contraceptive pills, vaginal contraceptive rings, hormonal injections, subdermal implants, transdermal skin patches, and intrauterine devices. Hormonal contraception alters the hormonal environment to prevent ovulation, thicken cervical mucus, and thin the lining of the uterus. An intrauterine device is a plastic device inserted by a healthcare provider into the uterus through the cervical opening. An intrauterine device may contain copper or progesterone. The primary mechanism by which both types of devices prevent pregnancy involves stopping the sperm from fertilizing an egg. The diaphragm is a round, rubber dome that has a flexible spring around the edge. It is used with a contraceptive cream or jelly and is inserted into the vagina, so it provides a contraceptive barrier over the cervical opening. The woman needs to be refitted after a significant change in weight or pregnancy. The cervical cap functions like the diaphragm. However, it covers only the cervix. It may be left in place longer, and some perceive it as more comfortable than the diaphragm. Both tubal ligation and vasectomy are usually considered permanent surgical procedures. Female sterilization, or tubal ligation, involves cutting, tying, or otherwise ligating the fallopian tubes. In male sterilization, or vasectomy, the vas deferens, which carries the sperm away from the testicles, is cut and tied. Case study. Nikki is educating Ms. Tamika Jones, a 16-year-old mother of 3, regarding the benefits of practicing safe sex and using effective contraception. Nikki explains to Ms. Jones that sterilization is the most effective birth control measure aside from abstinence. Can you answer the following? In females, sterilization is referred to as blank, whereas in males, it is referred to as blank. The answers are tubal ligation and vasectomy. Sexually transmitted infections. About 20 million people in the United States are diagnosed each year with a sexually transmitted infection, and almost half of them are 15 to 24 years of age. The prevalence of sexually transmitted infections is a major health concern for several reasons. Black and Hispanic populations are diagnosed with these infections more frequently than whites, and women have more complications associated with these infections than men. In addition, social factors such as poverty, low literacy, discrimination, use of illegal drugs, incarceration, sexual abuse, and racial segregation contribute to racial disparities in sexually transmitted infections rates. The site of transmission is usually genital, but sometimes it is oral genital or anal genital. People most likely to be infected share one key characteristic: unprotected sex with multiple partners. Gonorrhea, chlamydia, syphilis, and pelvic inflammatory disease are all caused by bacteria, and are usually curable with antibiotics. Patients need to take antibiotics for the full course of treatment. However, an emerging concern is that some of these bacterial infections, like gonorrhea and syphilis, are now developing antibiotic-resistant strains. Infections such as genital herpes, human papillomavirus, and human immunodeficiency virus are caused by viruses and cannot be cured. Please review Box 35-2, Evidence-Based Practice, Health Risk Behaviors Associated with the Human Papillomavirus Vaccine, as a supplement to this PowerPoint. A major problem in dealing with sexually transmitted infections is finding and treating the people who have them. Some people do not know that they are infected because symptoms are sometimes absent or go unnoticed. Common symptoms of a sexually transmitted infection include discharge from the vagina, penis, anus, or throat, pain during sex or when urinating, and unexplained rash or lesions. Because sexual behavior often includes the whole body rather than just the genitalia, many parts of the body are potential sites for these infections. The perineum, anus, and rectum frequently are involved in sexual activity. Furthermore, any contact with another person's body fluids around the head, or an open lesion on the skin, anus, or genitalia, can transmit a sexually transmitted infection. Nurse should develop communication skills and a non-judgmental attitude to provide effective care for those diagnosed with one. Detect valuable clues about a sexually transmitted infection by establishing trust, talking with patients, and asking questions in a caring manner. Assess attitudes toward sexuality, and adjust the intervention to make it acceptable to the patient's sexual value system. HIV infection is a blood-borne pathogen, and is present in most body fluids. It is sometimes spread through sexual contact. Transmission occurs when there is an exchange of body fluid. The natural history of HIV progresses in 3 stages. Stage 1, the primary infection stage, lasts for about a month after contracting the virus. During this time the person often experiences flu-like symptoms. When stage 2, or the clinical latency phase occurs, there are usually no symptoms of infection. HIV antibodies appear in the blood about 6 weeks to 3 months after infection. If left untreated, people who are infected with HIV live about 10 years. The last stage, acquired immunodeficiency syndrome, or AIDS, happens when a person begins to show symptoms of the disease. AIDS is a serious, debilitating, and eventually fatal disease. Highly active antiretroviral therapy, and having an experienced HIV clinician, greatly increases the survival time of people who live with this disease. Most human papillomavirus infections are asymptomatic and self-limiting. However, certain types can cause cervical cancer in women, and anogenital cancers and genital warts in both men and women. HPV is also referred to as genital warts. The textured warts often have a cauliflower appearance and are most common on the penis and scrotum in men, and the vagina and cervix in women. A vaccine that protects both men and women against 9 types of HPV that most commonly cause health concerns is now available. The bacteria Chlamydia trachomatis causes chlamydia. It is the most commonly reported infectious disease in the United States, affecting about 3 million Americans each year. Chlamydia is spread by contact with fluids from the infected site. The infection can be transmitted during the birthing process and cause conjunctivitis and pneumonia in newborn babies. It frequently infects the cervix and, if left untreated, can increase the risk for PID, ectopic pregnancy, and infertility from damage to the female reproductive organs. Most people do not realize that they are infected with chlamydia because it causes few symptoms. For this reason, the Centers for Disease Control and Prevention recommends annual screening for all sexually active women up to age 25. High-risk populations include those who have multiple sex partners, are infected with other STIs, and men who have sex with other men. Use critical thinking skills and basic nursing knowledge when addressing patients' sexual health needs. Draw from the following areas of nursing knowledge: socio-cultural dimensions of sexuality, decisional issues, and alterations in sexual health. People assign different meanings to sexuality based on their gender, culture, education, socioeconomic status, and religion. Each cultural and social group has its own set of rules and norms that guide sexual behavior, sexual health, and the willingness to discuss this private part of life. Pregnancy and menstruation practices vary among cultures. Some cultures encourage sexual intercourse or male-female contact during menstruation and pregnancy, but other cultures strictly forbid it. Research has found no physiological contraindication to intercourse during menstruation or during most pregnancies. Female sexual interest tends to fluctuate during pregnancy, with increased interest during the second trimester, and often decreased interest during the first and third trimesters. Sexuality is a significant part of each person's being, yet sexual assessment and interventions are not always included in health care. Sometimes nurses avoid discussing sexual issues with patients because they lack information or may have different values from those of their patients. If you are uncomfortable with topics related to sexuality, the patient is unlikely to share sexual concerns with you. Please review Box 35-3, Cultural Aspects of Care, Cultural Factors and Human Immunodeficiency Virus, as a supplement to this PowerPoint. Decisional issues. Pregnancy, whether planned or unplanned, significantly affects the life of the mother and father and often their support network. Choice of contraception method varies in relation to the age, marital status, income, education, and previous pregnancies of the woman. Sexual biases, comfort with touching genitalia, desire for future fertility, financial status, ability to plan sexual contact, and ability to communicate with the sex partner all affect the choice and use of effective contraceptive methods. Half of all pregnancies in the United States are unplanned, and most unplanned pregnancies occur in teenagers. women older than 40 years of age, and low-income non-white women. Almost half of unintended pregnancies end in abortion. Abortions have been performed since ancient times. The safety and availability of abortions in the United States improved after the 1973 Supreme Court decision Roe v. Wade, which established the right of every woman to have an abortion. Abortions are safer and less costly when performed in the early weeks of pregnancy. Be aware of personal values related to abortion. If caring for a patient contemplating abortion, provide an environment in which the patient is able to discuss the issue openly, allowing exploration of various options within unwanted pregnancy. Discuss religious, social, and personal issues in a non-judgmental manner with patients. Responsible sexual behavior includes knowing one's sexual partner, being able to openly discuss sexual and drug use history with the partner, not allowing drugs or alcohol to influence decision-making, and using protective devices. Time for a quick quiz. Which of the following populations have the highest incidence of STI? Select all that apply. A. Hispanic women age 15 to 24 years. B. African American men age 15 to 24 years. C. Caucasian men age 50 to 58 years. D. Caucasian women age 42 to 53 years. The answers are A and B. The highest incidence of STIs occurs in the 15 to 24-year-old age group, and in Hispanic and African American populations. Alterations in sexual health. Choices available for the infertile couple include pursuit of adoption, medical assistance with fertilization, and adapting to the probability of remaining childless. Sexual abuse crosses all gender, socioeconomic, age, and ethnic groups. Sexual abuse affects physical and psychological health. Nurses need to assess for sexual violence, to help patients confront these stressors, and to educate individuals regarding community services. Cues that raise a question of possible sexual abuse include extreme jealousy and refusal to leave a woman's presence. The overall appearance is sometimes that of a very concerned and caring husband or boyfriend, when the underlying reason for this behavior is very different. Rape victims often need to work through the crisis before feeling comfortable with intimate expressions of affection. The partner needs to know how to help and support the victim. Children who have been sexually molested need to understand that they are not at fault for the incident, and parents need to understand that their response is critical to how the child reacts and adapts. Ideally, sex is a natural, spontaneous act that passes easily through a number of recognizable physiological stages and ends in one or more orgasms. In reality, this sequence of events is more the exception than the rule. Nurses meet patients who have problems with one or more of the stages of sexual activity, including the feeling of wanting sex, the physiological processes and emotions of having sex, and the feelings experienced after sex. The incidence of sexual dysfunction in the general population is estimated to be as high as 40% in men and 45% in women. Men may experience erectile dysfunction. Risk factors for it are similar to those for heart disease. One of the most common problems affecting women of all ages is hypoactive sexual desire disorder. Biological, organic, and psychosocial factors can contribute to the incidence of this disorder. Please review Box 35-4, Illnesses and Medications that Affect Sexual Functioning of Men and Women, as a supplement to this PowerPoint. Time for a quick quiz. Upon admission, when gathering a patient's sexual history, nurses should A. Focus only on physical factors that affect sexual functioning. B. Discuss sexual concerns only if the patient raises questions or concerns. C. Use emotionally laden terms when discussing sexual concepts. Or D. Include questions related to sexual function. The answer is D. Include questions related to sexual functions. Sexual function is an important part of taking a sexual history, as it can indicate other problems the patient may be having. Case study continued. Nikki informs Ms. Jones that she has tested positive for chlamydia. Nikki explains that chlamydia is the most commonly reported infectious disease in the United States, but most people never know they have it. If it is left untreated, it can cause PID, ectopic pregnancy, and infertility from damage to the female reproductive organs, but it can easily be treated with antibiotics. Successful critical thinking requires synthesis of knowledge, experience, information gathered from patients, critical thinking attitudes, and intellectual and professional standards. Use previous experiences to provide care for patients with sexual issues in a more reflective and helpful way. Patients have different customs and values from those of the nurse. Professional standards require respect for each patient as an individual. Critical thinking attitudes such as integrity require you to recognize when personal opinions and values are in conflict with those of the patient and to consider how to proceed in a way that is mutually beneficial. Please review Figure 35-2, Critical Thinking Model for Sexuality Assessment, as a supplement to this PowerPoint. The nursing role in addressing sexual concerns ranges from ongoing assessment to providing information, counseling, and referral. Keep in mind that nurses are not expected to have answers to all sexual issues and concerns identified. The nursing process uses a critical thinking approach in order to provide care to the patient. It also provides a clinical decision-making approach to help you develop and implement an individualized plan of care. Be sure to assess all relevant factors, including physical, psychological, social, and cultural, to determine a patient's sexual well-being. Please review Figure 34-3, Critical Thinking Model for Sexuality Planning, and Figure 34-4, Concept Map for Mr. Clements, as a supplement to this PowerPoint. It is important to understand a patient's expectations regarding care. Questions such as what would you like to have happen in regard to your sexual health problems, and what initial steps might you take, help a patient identify desired outcomes. It is also important to set aside personal views and consider a patient's needs and preferences for care. Sexual desire becomes an issue if the person wants to satisfy it more often, if he or she believes that it is necessary to measure up to some cultural norm, or if there is a discrepancy between the sexual desires of the partners in a relationship. Ask patients to describe factors that typically influence their sexual desire. Knowing a patient's medical history and probing for information is helpful. Confirm factors that potentially affect sexual desire and determine with the patient the extent to which sexual function is impaired. Consider how self-concept issues relate to a patient's condition, which may result in diminished or absent sexual desire. Issues in a relationship often affect sexual desire. After the initial glow of a new relationship has faded, some couples find that they have major differences in their values or lifestyles. Ask couples to describe how close they feel to each other and how often they interact on an intimate level. Assess communication patterns between sexual partners to determine sexual satisfaction within a relationship. Most patients want to know how medications, treatments, and surgical procedures influence their sexual relationship even though they often do not ask questions. The PLISSIT model provides an approach that nurses can use to assess sexuality in patients. It includes permission to discuss sexuality issues, limited information related to sexual health problems being experienced, specific suggestion, only when the nurse is clear about the problem, and intensive therapy, referral to professional with advanced training if necessary. Nurses should incorporate assessment questions related to sexuality in the nursing history. Using an opening statement puts a patient at ease when introducing these questions. Use knowledge of developmental stages to determine which areas are likely to be important for your patient. It is also important to use language that is accurate, and that the child or adolescent understands. Also promote normal development, avoid minimizing problems, and screen for sexual concerns while making the child or adolescent feel at ease. Being open, positive, and interested when introducing sexual questions is helpful. In light of the prevalence of intimate partner violence, questions relating to abusive relationships are important. Address these questions in private. Recognizing both subjective and objective signs and symptoms of abuse in children and adults helps to identify this too common problem. Some individuals are too embarrassed or do not know how to ask sexual questions directly. Look for clues that a person has questions. Please review Box 35-6, Nursing Assessment Questions, and Table 35-1, Signs and Symptoms that indicate possible current sexual abuse or a history of sexual abuse, as a supplement to this PowerPoint. Awareness of the possible effects of physical problems, altered self-concept, medications, and the factors addressed thus far on sexual functioning helps in conducting a thorough assessment. In examining a woman's breasts and the external and internal genitalia, a nurse has the opportunity to assess the woman's reaction, answer questions, and provide information about the examination of anatomical and physiological structures. Knowledge of normal scrotal anatomical structures helps men detect signs of testicular cancer. Instruct both men and women on signs and symptoms of sexually transmitted infections during the examination, especially when patients' histories suggest risks for them. Possible nursing diagnoses related to sexual functioning are listed on the slide. Assessment data that signal a nursing diagnosis related to sexuality often include a history of surgery on reproductive organs, changes in appearance or body image, a history of or current physical or sexual abuse, chronic illness, or developmental milestones such as puberty or menopause. To make a nursing diagnosis related to sexual dysfunction, consider anatomical, physiological, socio-cultural, ethical, and situational issues thoroughly. Clarify defining characteristics and ensure that the patient perceives a problem or a difficulty with regard to sexuality. Determining the etiological or contributing factors helps to plan effectively and select the appropriate nursing interventions. Please review Box 34-7, Nursing Diagnostic Process, Sexual Dysfunction, as a supplement to this PowerPoint. Planning requires synthesizing information from multiple resources to develop an individualized plan of care. Professional standards are especially important to consider when developing a plan of care. Remember to maintain the patient's dignity and identity at all times. Goals and outcomes should be specific and measurable. A concept map is another method that is useful in organizing patient care. The concept map shows the relationship of a medical diagnosis to the nursing diagnosis identified from the patient assessment data. It also shows the links and relationship to the nursing diagnosis and interventions appropriate for each diagnosis. The priority in addressing needs related to sexuality includes establishing a therapeutic relationship so the patient feels comfortable in discussing issues related to sexuality. Look for strengths in both the patient and the family while providing education and access to resources to turn limitations into strengths. Patient teaching communicates the normalcy of feelings following certain situations. A patient's current problems and needs help you determine the priorities related to his or her sexual health. Planning in the area of sexuality often includes collaboration with other healthcare providers and referrals to community resources. Nurses generally raise awareness of sexual issues, clarify concerns, and/or provide information. It is necessary to understand the limits of your knowledge base and include other healthcare providers, such as sex therapists, clinical psychologists, and social workers, as appropriate to meet patients' needs for sexual health. Please review Box 35-8, Examples of Community Resources Relating to Sexuality, as a supplement to this PowerPoint. Promote sexual health as a component of overall health and wellness, by identifying patients at increased risk, providing appropriate information, helping individuals gain insight into their problems, and exploring methods to deal with them effectively. Educate patients about sexual health, including measures for contraception, safe sex practices, and prevention of sexually transmitted infections. Regular breast self-examinations, mammograms, and pap smears are important sexual health measures for women. Testicular self-examinations are important for men. Offer the 9-valent HPV vaccine to males and females who are between 11 and 26 years of age. Structure the environment and timing to provide privacy, comfort, and uninterrupted time. Topics of education vary and often are related to a patient's developmental level. Major developmental crises, such as puberty, climacteric, or menopause, prompt the need for education about sexuality. Strategies that enhance sexual functioning include the following: avoid alcohol or tobacco, eat well-balanced meals, plan sexual activity when couple feels rested. Take pain medication if needed before intercourse. Use pillows and alternate positioning to enhance comfort. Encourage tactile stimulation, and communicate concerns and fears with partner. Individuals who have more than one sex partner, or whose partner has other sexual experiences, need to learn about safe sex practices. Annual health examinations provide an opportunity to discuss contraception and safe sex practices. Never assume that sexual functioning is not a concern merely because of an individual's age or severity of prognosis. After identifying concerns, address them in the context of his or her value system. When a patient identifies sexual concerns, initiate discussion and education appropriately. Often nurses help individuals create an environment that is comfortable for sexual activity in the home. This sometimes involves making recommendations for ways to arrange the bedroom to accommodate physical limitations. Sexuality is felt more than observed, and sexual expression requires an intimacy that is not amenable to observation. Therefore, ask patients questions about risk factors, sexual concerns, and their level of satisfaction. Observe behavioral cues such as eye contact, posture, and extraneous hand movements that indicate comfort or suggest continued anxiety or concern as topics are addressed. Anticipate the need to modify expectations with an individual and partner when evaluating outcomes. Sometimes you need to establish more appropriate time frames in which to achieve target goals. Ask patients to define what is acceptable and satisfying while considering the partner's level of sexual satisfaction. When outcomes are not met, Begin to ask questions to determine appropriate changes and interventions. Examples of questions include the following. What other questions do you have about your sexual health? Did you experience less pain during sexual intercourse after taking your pain medication? Which positions did you find most comfortable when you had sexual intercourse? Which positions were most awkward? And what barriers are preventing you from discussing your feelings and fears with your partner? Please review Figure 35-5, Critical Thinking Model for Sexuality Evaluation, as a supplement to this PowerPoint.